If you have melasma and have had several treatments and failed to get a satisfactory result, or even for you who is looking for an effective and lasting treatment, in this video I'm going to give you some cool tips so you can reduce your pigment and turn it at times even imperceptible. Do you know what melasma is and how to identify it? Melasma is the pigmented stain, which usually affects here in the frontal region on the forehead, in the region here, the cheeks, the shady spot in the upper lip, which affects the majority of women and a small percentage in men. Did you know that melasma has depth? Exactly. You must look for a professional to do this analysis to see if it's superficial, medium or deep. But why is this important? Because once she knows the melasma depth, she will recommend the best treatment for you, simply like that. Did you know that melasma has its origin in genetics? You may have acquired from your mother, from your grandparents, from your great-grandparents. Exactly, and what triggers it is the hormonal change in your body. This change triggers your melasma, and what aggravates, intensifies it, leaving the pigment darker, it's the sun. In other words, the heat. Why? The shower, hot baths, hair dryer, oven, everything that is extremely hot also stimulates the production of melanin, which will consequently darken your stain. Now, a tip I'm going to give you, so pay attention. This is extremely important and many people don't know it. Did you know that stress triggers melasma? Oh, really? Unfortunately, yes, it's very serious. If you are a stressed, nervous, tense person who gets very anxious, under pressure, you may notice that in the following day, this pigment of yours is darker. Why? Because stress produces cortisol, and cortisol makes a mess of your hormones. Consequently, your stain will be more pigmented. So try to calm down. Look, I'm going to give you an essential tip for you to keep your melasma calm and very clear. First, work on reducing your cortisol level. Try to produce more serotonin. What does serotonin do? It's the joy hormone. It's the hormone that brings you peace, tranquility, and sleep. So get good, long sleeping nights. Get that slight problem that you have and let it go. Try to resolve it later. It's not worth losing a night's sleep and being more stressed. You are only harming your health, which will aggravate your skin. Gee, do you know now what is the correct way to take care of this melasma? Because many people may say, I did a laser there, my friend did a laser, it lined her skin, but and the rebound effect. You must be careful because many people don't do this evaluation to see how deep their stain is. They just go there and hit the melasma. What really happens? Immediately, after 2 to 3 months, it's lighting the stain, but then the pigment becomes darker and darker. Why? Because the patient didn't do the complete assessment. It attacked this melasma so hard, and how it responded with its defense. The melanin in our body is a protection, so it produced a bond to protect it. And what do I have to do? First, know the depth. Second, melasma must be treated with care, meaning you may even use an acid, but this acid must be a light one. How does this light acid act? By removing very superficial layers of your skin, and little by little, and not all at once, to not cause a big injury, darkening that region. So, if you want a lasting, effective result, don't attack your melasma. Treat him with care. Uses lots of vitamin C. Vitamin C, it is antioxidant. It fights these free radicals. Vitamin C also stimulates collagen production, leaving your skin glowing, hydrated, and beautiful. White clay has a whitening action. And now, one of the most important defenses, the sunscreen. Are all sunscreens the same? No way! Especially for you who have melasma, you must observe whether the sunscreen it has self-protection from UVA rays. The UVB, which has a high index, normally during the summertime, when we go to the beach, we get exposed and get all red, burnt. This is the UVB effect. Now, what stains your skin, what activates your melasma, what gives you wrinkles and even triggers skin cancer, known as solar melanoma, is UVA rays. So from now on, when you buy sunscreen, look for sunscreen that has high UVA protection. UVB, it must be photostable. What is photostable? It guarantees you with only one application. It will not vanish. It guarantees you that protection from dusk to dawn. So if you have melasma and work in an office, you don't need to go over it all the time. Because if you are inside the office, you apply this sunscreen, which is photostable, you apply your makeup, and after lunch, what can you do? You can take that little powder, which also contains the FPS, and reapply. You don't need to remove it and reapply it because you may think, oh, it doesn't work anymore, it's been 2 or 3 hours. Being photostable, it will not destabilize. It will guarantee you the protection, but a good sunscreen must have high UVA and high UVB protection. Be photostable and good for your skin type. If it's a lipid skin that is oily, or an alopecia skin which is dry, so know what your type and use it. Which one is the best, with or without color? Well, the one with color, what will it provide? It's just going to hide your imperfections, understand? In addition, it also provides a reflection. Do you know the television, the computer, that visible light also stimulates. It also stains our skin. So the pigment provides this protection, but there are some sunscreens which already do that. They already protect from ultraviolet rays too. So if you don't want to apply pigment, you don't need to, because there are some sunscreens which already do that. In summary, if you want a satisfying result, nice protection, high quality sunscreen, vitamin C, clay, and most importantly, lower your cortisol levels. If you are such a compulsive person and you can't do it alone, seek psychological help, medical help. She will medicate you and you will be able to stabilize that cortisol of yours. You will be able to produce more serotonin. If you do that, it will lighten your blemishes. The doctor will also even indicate some anti-free radical to fight your free radical. And in addition to all this treatment that you will perform at your home, look for a good beautician, a qualified one, for you to follow up. Because unfortunately, melanoma has no cure. But on an aesthetic clinic, there are other procedures that can lower your pigment a lot, allowing you to continue at home doing all the things I just said. Then look for a qualified and professional beautician, where she will evaluate your stain and will propose the best treatment for you. By doing this, you will have a satisfying and lasting result. And be careful, as some treatments cause the rebound effect. So be careful. Remember, anything that is too aggressive can cause the rebound effect. Therefore, everything must be done at a calm pace. Even if it takes longer, the result will be more satisfying. Avoid that short-term expectation. I'm going to apply a strong acid soon. I'm going to use a strong laser. I'm going to use CO2. I want the stain to disappear as magic. It doesn't work like that. Treat your melasma condition gently. You must calm the skin of yours, this pigment of yours. By doing so, you will have a satisfactory result. You will be able to soften your pigment and it will go unnoticed for a long time, and you will be happy with the result. And if you like this video, subscribe to my YouTube channel and like my Facebook page. I'm always posting beauty and health news. Also, leave your comment. Until the next video.